Hi, my name is Natasha Thompson, and my topic is wilderness first aid. I'm going to be doing a brief demonstration on a first aid kit. Putting together an effective, lightweight, and durable first aid kit is key to being able to properly utilize your training with wilderness first aid. A first aid kit should be assembled based on the factors of the backcountry trip you are taking. So the environment of the destination, the season and weather you'll be encountering, and the number of people that will depend on the kit and the number of days it could be needed for. The distance for medical care and your medical knowledge. Some things to consider with your first aid kit are always check the expiration dates and restock as needed. So just an example of that is this is a prepackaged aspirin package, and you can see that it expired June of this year. So we will not be using that, but just for demonstration purposes. Ensure your items are organized and waterproof. A good way to organize them is plastic Ziploc bags, and you can write on them with a Sharpie marker what all's in the bag, and they're also waterproof. So it's a cheap way to keep yourself organized and your supplies safe. Select a case for your items to keep them clean and dry. So just an overall way to keep them all together. This is just one example. I don't use this one anymore, but it's just an example of like a prepackaged one you can get. And as you can see, it's lightweight and pretty durable. And also, when you zip it up, it's supposed to be waterproof. This one isn't completely waterproof, but a good way to waterproof it would be to stick it in a bigger Ziploc bag. Familiarize yourself with the items in your kit. Don't pack things you don't know how to use, and study your wilderness first aid curriculum over and over until you are comfortable with your skills and your supplies. As far as medications, know pre-existing conditions of yourself and those in your group. Familiarize yourself with medications you may need, such as epinephrine for someone with anaphylactic allergies, insulin for a diabetic, nitroglycerin for someone with heart problems. Those are just some examples. Basic medication should be carried in all first aid kits, such as aspirin, which we have an example of that here. For chest pain, just a little pro tip, 3-2-5, stay alive. It's a little thing you can remember for someone with chest pain that you think may be having a heart attack. It just helps slow the heart attack down. And 3-2-5 is just the amount of milligrams you would give somebody with chest pain. Another couple things, pain reliever and anti-inflammatories would be like basic ibuprofen and acetaminophen. Also, another important thing is diphenhydramine for allergic reactions. These are just some examples of things you would have in your kit. Some other basic first aid things to have on hand would be shears for cutting bandages and or removing clothing from an injured person, an irrigating syringe to clean out wounds, EpiPen, non-latex disposable gloves, and dressings. And usually those will come in a pre-bought kit. Commercial tourniquet for someone that has a bleeding wound, pack dressing, moleskin for blisters, tape, commercial butterfly bandage, occlusive dressing, triangular bandage. Those are really important. You can use them for a lot of things, and a malleable splint. I can't go into too much detail in 4 minutes, but there's lots of great information online. I appreciate you taking the time to listen, and I hope you have a great rest of the day.